Hello, everybody. Thank you for joining us from the Caldwell Chamber of Commerce. And today we have some very special guests with us from Caldwell Hospice and Palliative Care. Say hello to our friends Frida and Brittany. Brittany, Frida, say hi to everybody.
Hello, everyone.
So today is really special. We all have a lot going on in our lives, but it's really important to know the care that's in our community. Um, and I'm so thrilled to have these young ladies on board with us today and talking about care. And Hospice and Palliative Care of Caldwell County is just an amazing organization. And, we're excited to see what they do. And we know times are a little bit challenging. So today we're going to talk a little bit not only what they do, but some of the things that they need through COVID because they're affected just like everyone else. So we want to highlight some of those items. We're going to share and learn a little bit more about what this organization does for our community, in case you didn't know. So there'll be some FYI stuff that's going to be happening out there. So up on our screen here, I wanted to call out Frida, and Frida, say hi to everybody again.
Hello.
Frida, you are a palliative expert. Am I correct?
So I am a doctoral prepared nurse practitioner. I'm the lead nurse practitioner here at Caldwell Hospice and Palliative Care.
Yes.
And I primarily do palliative care services.
Great. Excellent. And then you guys are offering palliative care, hospice care, and grief support, which is really very impressive to see what your website is. And you guys have a fairly new website, a lot of great information on your website, a lot for people to learn. And we'd like people through the course of this video recording today to learn a little bit more about what you do and why you do that. So Frida, talk to me a little bit about what we have up on the screen and really what your role is there at Caldwell Hospice and Palliative Care.
So our service area, of course, is vast. We see a lot of patients everywhere. Palliative care is a Latin term that means to palliate, to cloak, to support. So we serve patients with serious illnesses or patients that have serious prognosis. Prognosis being if their serious illness is life limiting. So
Yes.
in palliative care, we serve patients that have a serious illness that can extend for several years to several weeks to days. We do, as being a part of a two program, hospice and palliative care, we are able to support patients and their families from the beginning of the diagnosis of a serious illness until they need more assistance in the home or wherever they consider home until the time that they don't need us anymore. And then we only support the families thereafter. So we provide symptom relief. Symptoms is what we manage. So symptoms such as pain and nausea, indigestion, constipation, fatigue. We work on social support systems so that the patient can stay in their own home or environment. So we work with several of the home health agencies to provide support for the patient and families. We work on advanced directives or what I consider preparedness, decisions, goal setting, and preparedness. So we help the patients and families prepare. I always tell them it's better to plan for the worst and hope for the best.
Right.
But we have to be prepared. So we walk along the trajectory with the patient and family. So it is not to take over their care. It is to help them manage their care and symptoms.
That's great. I don't know. I'm just speaking from my perspective, but through the years, I didn't really understand what hospice or palliative care was, and it's really good to learn more about what you guys do and how you help people. I've been a benefactor of hospice care for a few family members myself, and before we got on this call, I shared a couple tears because of the care that you guys have for our community. So I want to just call out your website because sometimes it's some websites are challenging and difficult, but you guys have such a great website. And I've got up here is a copy of some images from your website. And I love, Brittany, maybe you can talk to me about this. about, looking for care. I'm grieving. I want to help. I need help planning, and maybe I need to refer someone. And how simple that is, but how important those questions are for people to see.
Yes, we try to make accessing the services that we provide as easy as possible for our community. Because if you are in a position to need to consider hospice care, to have been diagnosed with a serious illness and you're dealing with symptoms, if you think that you may need palliative support, that's already kind of a tough situation to be in. So we want that to be as easy as possible for our community. So they are able to go to the website and just click those simple links. We'll take them to some instructions, some online options to request some contact, or they can just call our main number, and that will connect them with any of the services that our programs provide.
That's fantastic. I also want to call out how awesome your facility is there in Hudson. I was fortunate enough to take a great tour over there with our Leadership Caldwell group a few months ago before COVID. I think that was our last Leadership Caldwell gathering, was over there before we had to stop gathering. And it was such a beautiful place and such a wonderful facility, and your staff is so great. So kudos to all of you for having the heart and for being heroes that are out there helping serve people. So
I would like to mention, in terms of the facilities, both facilities that we have, they are home environments.
Correct.
So all of our rooms are private rooms, and it is a home environment. And we have family rooms and waiting rooms that are designed just for families and patients. So it is indeed a facility itself, but we welcome all to come and just visit. It is more of a home environment.
Well, I can tell you.
We often tell our patients, I'm sorry, Brian, but we often tell our patients when they come to stay at one of our patient care units, that is their home now. And we want them to feel like they're at home. We want them to have the comforts of their home. Because usually patients are with us because they have symptoms to manage that can't be managed in the home environment, or because they may need a respite. Their loved ones may need the opportunity to rest and know that they are receiving the same kind of care they would receive at home. So we work really hard to do that.
That's great. I have to throw your name up there, Brittany Bond, clinical liaison over there. So just wanted to put that up on the screen for everybody to see. One of the things about your facility in Hudson, it's almost like a historical museum, because some of the photos that you guys have and pictures and maps that are up on the walls, I could stand there for hours just studying some of the information that was up there. So it's really neat. It is very much a homey, good feeling place for such a difficult time for a lot of people. So thank you again for what you guys do. I'm going to jump us over to your service map. Frida, you mentioned this, and I don't think a lot of people recognize that just because it's Caldwell Hospice and Palliative Care, that they really recognize how much you serve the High Country and our whole Unifor region. It's a big, broad area that you're serving.
Yes, we serve, of course, Caldwell County, and then we serve patients who are in our surrounding counties as well. And a few years ago, we were invited by Appalachian Regional Health System to begin offering hospice care and palliative care in the High Country, which is Ashe, Watauga, and Avery counties, because those areas were underserved and had additional needs in hospice and in palliative care. So we, after a lot of consideration from our leadership, answered that call and have been serving there ever since. So we're happy to be there.
I love it. It's a big footprint that you guys are covering and serving. So it's neat to see that you guys have expanded. And I'm going to show another logo that you guys have that helps represent the High Country as well. So that's really, really good. Hey, Frida, why don't you talk about 37 years of service to our community and some of the things that we have here on the screen, 12,000 clients served, and amazing amount of volunteer hours that have been put in to help take care of people.
So I'm glad you did put that one up. 37 years of service suggests longevity, but also that we have a wide array of professionals. We've been in the business for a long time, and so we've learned a lot and we know a lot in terms of what patients and families may need. I always tell them, let us be the expert to try to help you walk through the medical system, which is so tedious to do so. And it's more so tedious when you have a medical emergency or a serious illness. You have no idea what to do, who to go. So we want to walk with them. I say, let us walk with you through this serious illness so that we can do some guidance. The patients that we serve, I know you showed our hospice homes and we've discussed those, but we serve patients in our palliative program in the community itself. So we serve patients that are in their own home environment. We go to nursing homes, skilled nursing facilities, assisted livings, group homes. We serve in the hospital. We have consult services in which we serve patients that are in the hospital, our area hospitals, as well as UNC Caldwell Hospital.
Yes.
We serve patients at several clinics. Currently, we go to the cancer clinic, McCurry Cancer Center, and we serve patients there. I have served patients at the Wig Bank, which is just adjacent.
Yes.
I have served patients in the Walmart parking lot.
Wow.
And so we're wherever you need us to be. We can be there to help support you with your symptoms associated with your serious illness. So when you think about our program and patients say, do I have to go to the hospice home? No, we're going to serve you where you are and meet your needs as we're able to do. So we see patients everywhere.
That is great. That's amazing. You know, I look at you guys as quiet giants. You're not raising the flag, but you guys are serving in such an amazing, great way. So I can't thank you enough. My third thank you. So thank you for doing what you've got for serving the community. CaldwellHospice.org and your phone number 828-754-0101 is up on the screen. And just great volunteers. I know you guys thrive on an incredible amount of volunteers that come in and help serve the community. Brittany, you want to talk a little bit about volunteers?
Oh, yes. I have a big soft spot in my heart for our hospice volunteers. We have right now in this community about 300 folks on our volunteer roster who spend their time helping us support our patients. Pre-COVID, our volunteers went out with our hospice patients and did home visits, provided some companionship, would sometimes provide some like respite sitting if the patient's, primary care person needed to go to the grocery store or needed just to have some time away just to breathe and refresh. The volunteer could sit for a few hours with that patient and keep them company and make sure that they were safe. We also have volunteers who specialize in supporting patients. Let's say we have a hospice patient who's nearing the end of their life. We have volunteers who are specially trained to help us provide presence in the home with that patient and that family, so that they are not alone and that they know that they have that connection to their hospice team there. And we have volunteers who are veterans who are specially trained to provide additional support to veterans who are reaching end of life, who have unique needs because of their experiences with their service. We are just so blessed. We have specially trained volunteers who support our dementia patients. There's so many things that that's our 11th hour volunteers who sit with our patients who are approaching end of life. We have an amazing group of people who are willing to give their time and who really are, they are at the heart of what we do. And we're very, very blessed to have them.
That's great. So if you wanted to volunteer, you could just go to the website. You could volunteer, reach out. Is there anyone special they should ask for if they were interested in volunteering?
Yes. Our volunteer coordinator is Cindy Akins, and our volunteer support specialist is Crystal Birch. So those are, but if you ask about volunteer services, you'll be able to reach either of them.
Yes.
That is really, really good. So I want to talk about COVID. So we said we wanted to wrap this up, and there's that other logo for the serving the high country. So it's really nice that you guys have there. But in a real quick second or moment here, let's just talk a little bit about some of your needs. Because of COVID, there's a lot of increased demand. Let's put it out there. Frida, you want to talk a little bit about some of these special items and why they're important?
So as we are going through this pandemic crisis that we have in our area, we need to have more supplies to keep patients and families safe. So we're asking for any medical supplies and gloves, hand sanitizers, thermometers, so we can do some monitoring, any disinfectants or cleaning utensils. I will mention that we have had a lot of support so far from different groups that have made a mask and donated masks, which have been wonderful. We've had some organizations that have donated gloves and hand sanitizers and different chemical wipes so that we can keep things clean, to keep the patients safe, the family safe, and the staff safe so that they can provide the care. The donations are still welcome. We want those, that people can still provide those if they're able to do so. So we want to do that. We want to keep everyone safe. And I think our crisis is not over as yet. We still have quite a bit of ways to go.
You're right. Well, I know if someone wanted to donate something, they could reach out to April Moore, and it is amore@caldwellhospice.org. And the main phone number can reach April as well, which is 754-0101. Well, I want to thank you both very much for your time today. I'm going to go back to the last slide, if it'll allow me to do that, there with your phone number and website. I think it's one of the best websites in all of Caldwell County because it's simple, it's easy, and it's very informative. So I want people to be able to get to your website, check out what you do, learn more, and volunteer if they need to. So thank you both very much for your time today.
Thank you so much for having us.
My pleasure. And let us know if we can do anything more to help you. So have a blessed day, and we'll wrap this up. Thanks much.
Thank you
so much.
Bye now.
Bye.
Bye-bye.